Stephanie Wheeler, and it's my privilege to welcome you on behalf of my colleague Elisa Smith at the U.S. Environmental Protection Agency Indoor Environment Division, and on behalf of Maureen Wills from the Centers for Disease Control and Prevention, National Centers for Environmental Health, Air Pollution, and Respiratory Health Branch. Our programs have joined together to present this exciting webinar series. Well, what I'd like to do while we're waiting is to introduce our speaker, and then perhaps we can hold a little bit of conversation before we officially get started. Dr. Christie is an associate professor in the School of Behavioral and Organizational Sciences at Claremont Graduate University. Dr. Christie co-founded the Southern California Evaluation Association and is the former chair of the Theories of Evaluation Division and the current chair of the Research on Evaluation Division of the American Evaluation Association. She received the 2004 American Evaluation Association's Marcia Gutentag Early Career Achievement Award and is a section editor of the American Journal of Evaluation and an editor of two recent books, Exemplars of Evaluation Practice and What Counts as Credible Evidence in Evaluation and Applied Research. Dr. Christie?
Yes, thank you, and I appreciate all of you joining us today. The way that I wanted to start this session was actually talk to you guys a little bit about the differences between evaluation and research. The overall goals for the session are for us to really examine steps 4 through 6 in the CDC evaluation model. It's a 6-step model, and then identify some practical strategies for promoting and increasing evaluation use, which is really part of steps 5 and step 6. So we're going to spend some time, though, talking about step 1, which is engaging stakeholders, because it is my belief that we promote use through the engagement of stakeholders. So I think there are people who would argue that actually step 1 of the model persists throughout all 6 steps, that it's not just an initial step, but that's where that initial engagement happens with program stakeholders, and then it persists throughout the entire model, particularly if we're interested in promoting use. So if you don't have the model in front of you, the 3 steps that we're going to focus on are step 4, gather credible evidence, step 5, justify conclusions, and step 6, ensure use and share lessons learned. The first 3 steps, as I mentioned, number 1 is engage stakeholders. Number 2 is to describe the program. Number 3, to focus the evaluation design. And when we talk about steps 4, 5, and 6, I think it's important to sort of distinguish evaluation from research, because there are some key dimensions on which evaluation and research are distinct from one another that actually relate to steps 4, 5, and 6 in the model. Next slide, please. And so I would argue that the study purpose is one dimension that distinguishes research from evaluation, in that the primary purpose of research is to add knowledge to a field, to offer some generalizable conclusions. In evaluation, it's to make decisions or some judgment about the impact or the effectiveness of a program. Now, that doesn't mean that these are mutually exclusive. That doesn't mean that in evaluation we don't also strive to add to the general knowledge base of a particular subject area, but yet it is a secondary purpose to providing information to make decisions. And there we can see this connection to evaluation use, hence step 5. Another distinction is who sets the agenda for the study. In research, it's the researcher, and in evaluation, it's significant stakeholders. And that's why step 1 is important, because before we describe the program and focus the evaluation design, we have to understand what it is that stakeholders want to know about the program. In research, We can decide what it is we want to study. We really don't need anybody to agree with us that it's a reasonable question. If we were so inclined, we could actually go outside and talk to people who are willing to talk to us. We don't really need to gather the information for anybody else. So that's a dimension on which we distinguish evaluation from research. Who sets the agenda? Also related to generalizations. In research, and this also relates to the study purpose, we really are designing a study to maximize its applicability across settings, places, people, contexts. When we ask the question, how generalizable are our findings? That's what we're referring to. In evaluation, we're very much driven by the specific needs of the particular context. Now, again, like the study purpose, these things are not mutually exclusive. It doesn't mean that if we are designing a study that's offering information for a specific context, that we can't also maximize our design so that we can make some generalizable conclusions about the program. But nonetheless, in evaluation, our primary purpose is to tell us something about what's happening in that specific evaluation context. Next slide, please. So when we think about evaluations that are useful, when we think about steps 4, 5, and 6, gathering credible evidence, ensuring use and lessons learned, justifying our conclusions, we really have to think about, well, what kind of impact does the evaluation have? We could think about evaluation use as being sort of somewhat synonymous with the impact of the evaluation. So in other words, you have the evaluation process and its findings, and you have program activities, and your intention is to gather some data systematically that will somehow improve those program activities to promote social betterment. To connect those two pieces, the evaluation, its process, and findings, to program activities, and having an impact on program activities, some sort of evaluation use has to happen. So use is actually the connection between the work of the evaluation and the program or policy activities that are intended to promote social good or improve society. Next slide, please. Some would argue, actually, that use is a motivator for conducting evaluation. So that really why we actually go out and do evaluation is to provide information for decision making and to improve programs and policies. And so it actually serves as a motivator for us to engage in this activity. Next slide, please. So what do we mean by use? There are 4 general categories of use, and it's often good to become familiar with these terms, although they are absolutely terms of art. So they are very specific to the evaluation field and discipline, but help us when we think about, when we really want to distinguish evaluation from research and we want to connect evaluation use to what it is we're doing and actual improvement in programs, it's useful to understand what these terms mean. So there's instrumental use, which is really the use that happens as a direct result of the evaluation. There's some immediate and specific action that takes place as a result of the evaluation study. And it usually happens within a short time frame from either interim or final findings being communicated to program stakeholders. So there's some decision that's made. Sometimes that decision, that instrumental use, is evidenced in actually nothing changing at all. So we don't necessarily have to see some sort of actual change in program activities. It may just be that we think everything is going okay, and let's continue on the trajectory in which we're working. There's enlightenment in conceptual use, and we can think about this more like the generalizable knowledge. So this is the more general learning that takes place as a result of evaluation. So this is the maybe more of how we might think about the kinds of use that we might get from an applied research study. As I said, those aren't mutually exclusive, and we can see that here. Process use is what happens to people and organizations as a result of participating in evaluation activities. In other words, it's the transformation that happens to individuals and organizations by virtue of just being involved in the evaluation. I like to think about it as internal capacity building. And so stakeholders, program stakeholders might not really understand much about study design, but as a result of participating in your evaluation, they now really understand the strengths and limitations of different study designs, and now are really more informed consumers of evaluation. So that's an example of process use. And then capacity building, which there's some debate in the literature about how different really is capacity building from process use. And I really like to distinguish them by saying that capacity building is really intentional. So you walk into the site and you say, along with our evaluation, we are going to implement activities that build the capacity, the evaluation capacity of people within the program. Process use, I see it more as something that happens less intentionally. So that would be the difference between those two. So how do we foster evaluation use? Well, we need to determine the information needs of relevant stakeholders. We need to engage stakeholders. We need to ensure that our data are considered to be credible based on the values of our target stakeholder audience. And then we need to present it in a way that's meaningful and accessible to them. And so you can see how these relate to the last three steps in the CDC model, steps 4, 5, and 6. Credible evidence. It needs to be useful, and we need to, going back to step 1, ensure that we have a real sense of what it is that our stakeholder groups would like to know so that we can justify our conclusions and ensure use and lessons learned. Next slide, please. Okay, so for those of you who have seen the CDC model before, this will look very familiar to you. For those of you who are seeing it for the first time, one of the things I like about it is its clarity and its simplicity. We see the 6 steps in the model, with step 1 being engaging stakeholders, and we're focusing the rest of our conversation today on steps 4, 5, and 6. And but for us to sort of ground that conversation, I'm going to revisit just for a moment step 1. So next slide, please. Thank you. So the first step is engaging stakeholders. And as I mentioned, I think it's important to revisit step 1 because it really does set the stage for steps 4 through 6. So what is step 1? Well, really, it's about fostering the input, participation, power sharing of persons who have an investment in the evaluation and its findings. It's especially important to engage primary users of the evaluation, and we'll describe who they are in just a moment. The impact of this is that it really helps increase the chances that the evaluation will actually be useful in the end. It can also improve the evaluation's credibility, and that really does matter in terms of getting people to use what it is that you're generating from your study. It also helps everybody really get on the same page with respect to who's doing what and the kinds of issues that we think about when we're designing a study. So protection of human subjects, the extent to which we have some cultural competence when we are working with groups who may be different from ourselves, and so on and so forth. Next slide, please. So when do we consider use? And this is what I said a little bit earlier on, where I suggested that step 1 is something that we think about throughout the duration of the 6 steps. So we think about it at the start of the evaluation, throughout the evaluation. So we say, hey, we care about it all the time. probably the one critique I have of the model is that ensuring use and lessons learned is the sixth step. I think it really would behoove folks to think about that sixth step as actually being carried through the entire model. Because when we think about things like process use and capacity building, they're happening as we describe the program through program theory, engaging around developing program theories and logic models and focusing our evaluation design. That's where we're getting at a lot of our process use and our capacity building. So I see it actually happening throughout the model, but I also understand why it's done in steps, because it's clear and it makes sense. Next slide, please. So really, there's been some research done on what increases evaluation use. How do we accomplish steps 5 and 6 of the model? And it's one of the areas of evaluation practice that actually has a reasonable empirical base, so it's informed from empirical work. And there are two conditions that are absolutely necessary. The evaluation must be considered accurate and it must be considered relevant. And accurate does absolutely tie directly into step 4, which is gathering credible evidence. Relevant takes us to step 1, step 2, and step 3. So have we engaged our stakeholders? Have we articulated the program in the way that makes sense to our stakeholders, as well as have we focused the evaluation questions around things that they care about? Next slide, please. So our research on use tells us that not only are these two conditions necessary, but then there are 3 factors that lead to use. The personal factor, which we'll describe in a moment, credible evidence, and political factors. The model speaks directly to personal factor and credible evidence. Political factors, for any of you who have ever conducted an evaluation or an applied research study, you are very well aware of how the political factors can impact both negatively and positively what it is that you're trying to accomplish. And so they're incredibly important, less predictable, very tied to context. There are some strategies for dealing with political factors. One of them is not to try to stay above the fray of what's going on politically, to really try to understand what's happening politically. But again, not directly addressed in the model, but definitely something that undercuts every step of the model whenever you're doing applied research or evaluation. So we'll talk a little bit more about the personal factor and credible evidence. Next slide, please. The personal factor was first described in this very particular way by a gentleman by the name of Michael Patton. And what Patton says is that the presence of an identifiable individual who personally care about the evaluation and the findings it generates increases use. Next slide, please. And what he describes is something called intended use by intended users. And if you flip through the publications that support the CDC model, you'll see this phrase. You'll see intended users. You'll see intended uses. So I think it's important to introduce them here. And the idea here is that people use information, those are your intended users, and that users have specific information needs, those are their intended uses. And that these intended uses actually focus the evaluation. Next slide, please. So who are these intended users? Well, they absolutely have to be people who want to participate in your evaluation as stakeholders. So they have to be willing and able to use information. And they tend to be people who have some sort of formal position and authority to make a decision. Because when we think about instrumental use, really critical there is that decisions are made. When you look across the research, you see that usually you have a group of about 6 intended users that you're engaging throughout your evaluation process. More than that, I think, becomes difficult to handle, and less than that, perhaps you're not including some key people who in the very end will have to use your information. So we say sort of keep in mind that 6 is about a good number when you think about this. One of the criticisms of this, and I will be upfront about it, is the point about the person having a formal position of authority in decision making. And people have criticized this approach, this idea of engaging intended users with intended uses, for this very point. And so what it suggests then is that people who have formal positions of authority retain those formal positions of authority, that people from underrepresented groups or less powerful groups really can't shift the power structure if you're dealing with people who, if you're only really dealing with people who are in formal positions of authority. So it's a reasonable critique, I think, of this approach, and something that you should be aware of as you sort of think about this idea of intended use and intended users. Next slide, please. I think it's useful to think about your intended users if you kind of break them out into 3 separate stakeholder audiences. You have primary, secondary, and tertiary audiences. And your primary users are likely to come from your primary audience and perhaps your secondary audience. There aren't many from the tertiary audiences. Remember, this is sort of an intimate group. But that doesn't mean that at the end of the day you wouldn't want a tertiary audience to use your information. It's just that their information needs aren't driving exactly what it is that you're doing. Next slide, please. So what are intended uses? Well, we want to render judgments, facilitate improvements, generate knowledge. Again, we sort of see the blurry line between research and evaluation and our different kinds of use. And the evaluator really assists the intended users in determining what the intended uses are going to be. Next slide, please. Okay, so these are some questions that I thought I would offer you to think about when you're thinking about this idea of intended users and intended uses, and sometimes it seems abstract, right? Well, here are some sort of concrete questions you can ask people to get a sense of understanding the use context. So what decisions are the evaluation findings expected to influence? By whom? When might the findings be presented to ensure use? What's the history and context of decision making? What other factors will affect the decision making? Politics, personalities, promises. How much influence might the evaluation have? To what extent has the outcome of the decision already been determined? This is a real reality, genuine reality for people who conduct evaluations. What data are necessary to inform the decision? Back to the credible evidence step. And then what needs to be done to achieve use? In other words, who needs to have buy-in? Next slide, please. So what are the critical activities? You have to consult insiders, take special effort to promote the inclusion of less powerful groups, I think, to sort of to deal with that issue of having mostly people in positions of authority who are involved in your evaluation. Coordinate stakeholder input. And again, as I sort of touched upon before when we talked about 6 being, sort of a reasonable number of people you might engage, avoid excessive stakeholder identification because you could get to the point where you can't get anything done if you're trying to meet everybody's needs. In other words, you can't be everything to everybody. Now, the gathering credible evidence stage is really, it's a funny stage to talk about in terms of, what in this sort of context, because really what we're talking about is selecting the methods that you're going to use that will help us generate accurate information. And I think what's unique about this stage is the piece that that's the first point on the slide, which is that the information has to be perceived to be trustworthy and relevant to those involved in the evaluation. I think most of us involved in evaluation are familiar with quantitative methods and qualitative methods, and we can talk about, survey design and using extant data and focus groups and the other sorts of methods that we use to gather information. But actually, the piece here is, will that information be considered credible to the people who have to make the decision in the end? Because if they don't see it as credible, if it's not accurate in their minds, then they're not going to use it. And what's credible to me or to you may not be credible to them. And there's definitely an issue here related to cultural norms about evidence, beliefs about theories of knowledge, and those sorts of things. So I think that is really the defining piece here that's interesting to talk about in this stage. If they find the data to be credible, they're more likely to accept the findings and to act on the recommendation. And so sometimes I find myself in a situation where, and we find this at the federal level, let's use, for example, the No Child Left Behind legislation, where there's been a real significant push to use the randomized control trial, the experimental design, and that's really what is considered to be credible, convincing evidence. Anything less than the randomized control trial, well-done randomized control trial, the evidence that's generated from that evaluation, at least as far as the Department of Education is concerned, is considered to be less credible. Next slide, please. So we have to think about, I think, the quantity, the quality, and then given our program context, what is it that we need to offer our stakeholders so that it's considered valid and reliable to that group? Next slide, please. Okay. So what counts as credible evidence, then, is really what the question is. And what impacts that question? Well, how the evaluation questions are posed impacts that question. So if we say we want to know if X caused Y, then in most of our settings, we're talking about conducting some sort of experiment. Beliefs about truth, knowledge, and knowing, the sources of information, the conditions of our data collection, and these will vary from context to context, user to user. If we have a very small-scale program that's seeing, perhaps 75 clients in a year, it's really hard to think about running a randomized control trial at that site. And in fact, those people might not even need that level of evidence to be convinced that their program is working or not. Speaking to program participants and getting a real sense from them in a focus group or in one-on-one interviews of how the program is impacting their lives might be the kind of evidence that that program considers to be credible. And so we need to determine that from the outset. Next slide, please. When we think about the different designs that we use, I mentioned the experimental design. That's where we have random assignment. We consider that, some consider it the gold standard. It's a question that's up for debate theoretically, but now I think also practically because we're seeing so much evaluation work. Quasi-experiments, which have two groups. There's some comparison going on either within group or between group. And the distinction between the quasi-experiment and the experiment is there isn't random assignment with the quasi-experiment. And then non-experimental designs. This would be survey research, case study research, anything other than an experiment or a quasi-experiment. Next slide. Our data collection methods available to us are quantitative and qualitative. I find that in evaluation work, we use some combination of quantitative and qualitative methods. And if we think about doing a process evaluation and an outcome evaluation, and oftentimes we examine our program processes using qualitative. I'm talking about this rather broadly, but we often use qualitative methods to study process. We often use quantitative methods to study outcomes. So you could see how mixed method studies really become very useful in the context of examining the impact of programs. Next slide, please. So just to review, I know this is probably very, very familiar to all of you. So the methods we think about are surveys, interviews, focus groups, observations, tests or assessments, document review. And I think, again, the critical point for this step is how we engage stakeholders to actually determine what they consider to be credible evidence, and how that, in fact, might affect the type of evaluation design or data collection methods you might use. Next slide, please. Okay, so for step 5, I inserted the word fair justification of conclusions. Really, the step is justification of conclusions. But I think when you talk to stakeholders, and if we have step 6 in mind, in sharing use and lessons learned, what they want is really a fair justification of their conclusions. They want to really know that that what's being presented about whether or not their program is doing well, what about their program is doing well, what about their program could be improved. They just want to make sure that it's being done fairly. So what we say is that evaluation conclusions are justified when they are linked to the evidence gathered and judged against agreed upon values and standards set by the stakeholders. So again, thinking back to step 1 when we're engaging stakeholders, and when we think about getting a sense of, from our stakeholders, what constitutes credible evidence to them, we also should get a sense of what are their values and standards for what makes a program good. And I've had some really interesting exchanges around this. I always speak to stakeholders, program stakeholders about, so if your program, if I were to say your program was doing really well, what would I see? And I get them to articulate that for me and to describe for me what it might look like if it's doing just okay. And then what it might look like if I were to say, if you were to say, that it was just not succeeding. What's happening there? And with the articulation of that, you come to some shared sense of what's the expectation that stakeholders have for program success. Now, I've had some situations where, most of the time stakeholders are very reasonable about this. But I was working with this program that was enrolling formerly homeless men into a case study program who had just recently come out of a substance abuse program, an in-residence substance abuse program. And ideally, they were going to get 100 guys in the program. And I said to them, now, if you have huge success with your program, how many of your clients will remain clean and sober and become employed, which was another goal of the program. And they said, about 30%. And so I said, well, I think we should be we're talking about incredible program success. Let's get a sense of it. And they really were, very cautious about committing to success beyond 30%. Now, when you get stakeholders to articulate incredible success at 30% and, program failure at 10%, you have to try to work with them and get them to think, in a broader range as to what would mean success and what would mean the program was unsuccessful. It's an unusual example, but nonetheless is a true example. Another example I have, which I found was really interesting, was I've been doing some work with a local community college, and they are working with students who are coming in to the community college with a high school degree, but these kids really are not proficient in basic arithmetic. And so they have a program designed to increase the likelihood that the kids will succeed in math, and so there's a number of courses that they take to teach them basic math skills. And when you talk to faculty in the program, I'll say, how do you define success? And they say, well, success in my class is a B or better. When you speak to administrators, they tell you success in our classes is a B or better. It's pretty agreed upon. There isn't much to talk about as far as they're concerned. It's a B or better. Well, it dawned on us one day that we should probably ask the students how they define success. And their definition of success was quite different than the faculty and the administrators' definition of success. Their definition of success was not dropping out of the class. So if they were to go to the class, sit in the class for the entire semester, and get an F, they considered that successful because they had no expectation of ever being able to pass that math class the first time through. So that was something important for us to learn to share with faculty and administrators. Now, it doesn't mean that they changed their definition of success, faculty or administrators, but it gave them some insight into what the students saw success as. So that's another interesting example of how that could be different for different stakeholder groups. Next slide, please. Here are the standards, the interpretation, the judgment, and the recommendations offered by the CDC for this particular step. Things to think about: which stakeholder values provide the basis for forming your judgment. So that kind of builds upon the example I just offered. It's faculty and administrators' definitions and values of success, not the student's definition. What type or level of performance must be reached for it to be considered successful? What do the findings mean? In other words, are we talking about statistical significance? What is the practical significance of what it is that we've learned? When we're dealing with very large numbers, large sample sizes, we're almost always going to find a statistically significant result. So what is our effect size? What are other sorts of measures that we need to ensure that we offer to justify our conclusions so that we support the practical significance of what we've learned? What claims concerning the program's merit, worth, or significance are justified based on the available evidence and the selected standards? So is it really, is it fair to say that a program is doing well if we've done 11 interviews with program participants and 4 focus groups, but the program's seen 250 clients? That sort of thing. And then recommendations. What action should be considered when we sort of start making judgments about the program? How do we justify our conclusions? What do we do about recommendations? And I am always called upon to make recommendations when I'm the evaluator. Program people will say to me, so what are your recommendations? We want to see your recommendations. Sometimes they want to see the recommendations before they see the findings. And I actually am somewhat cautious about my recommendations. And I'll talk a little bit about that as we start toward the end of the webinar. But sometimes I pose recommendations in the form of questions. So instead of saying, we recommend that you decrease the number of clients that you serve in this program, I might ask the question, what would be the implication on the program if you decreased the number of clients that you saw over the course of a year? So that it really puts the recommendation, it places it into the hands of the stakeholders for them to discuss, rather than it coming as a statement from me about what it is that I think they should do. Just an idea. There are plenty of evaluators out there, colleagues of mine, who I respect incredibly, who have no problem making recommendations. I make them. I'm happy to make them, but there are also alternative ways to present recommendations, and that's what I'm trying to offer you. Next slide. So what are the critical activities here? Well, as you can see, we have to make sure that we use culturally and methodologically appropriate methods. We interpret significant results. for deciding what the findings are going to be, make judgments according to clearly stated values. Again, everything that we've sort of covered to this point. I think it's important to think about alternative ways to compare results. So oftentimes we don't have the resources to do a matched comparison study. So I always think creatively about usually using national norms and national data sets to compare. If you can pull from that national data set a reasonably comparable sample, that often gives people a nice perspective on where their program sits in relationship to what's happening in the broader context. I also generate alternative explanations for a finding. I don't just say, hey, this is what we found, and it's probably why, but really think about what could have led us up to this point, to this particular finding. Always recommend actions that are consistent with the conclusions. In other words, really keep your recommendations tied close to your data. And I would also be very careful to limit the conclusions to situations and time periods and persons and contexts for which the findings are applicable. So I don't know that if I learned something about a program in California that I would necessarily draw those same conclusions about a program in Kentucky. The contexts are just too different. It might be appropriate, but I always ask the question, at what level am I comfortable drawing my box? So if I were to draw my box around the extent to which I think these findings can be used out within the box, how big is my box? Is my box the West Coast? Is my box my county? Is my box my state? How comfortable am I speaking about my findings? How do I draw my box? Next slide, please. One thing I do is it's a strategy that I use. It's called mock data application scenarios, and I do it early on. So I do it earlier in the steps of the model. And what I do is actually fabricate and make up possible results. This is how I get at sort of these standards and beliefs about credible evidence and what people read, what are their values around the kinds of evidence we're going to collect, and then how might they consider the program. If I were to say it was effective, would they see it in the same way? So what I do is I actually do these mock data application scenarios with them where we sit down and I fabricate some data and I say, now, if this were the data that I were to be presenting you toward the end of the study, what would you think about it? Would you tell me that your program was successful? Would you consider this to be credible? How many more people would I have to talk to for you to think this was actually credible evidence? Give them something tangible, something real to look at. And I find it sets some realistic expectations about what it is that we might learn from the evaluation, which is another sort of nice side effect of using these mock data application scenarios. Next slide. As I mentioned before, I think it's really important to strive for balance, to be clear about our definitions, particularly related to when we're saying something is good, when we're saying something is not so good. We're saying something is acceptable. What does that mean? We have to make our comparisons very carefully and appropriately. And as I mentioned, I don't think we should ever surprise stakeholders with negative findings. You know, I always say nobody questions what it is you've done, the methods you've used, your study design, the questions you've asked, your sample, if you tell them their program is great. You tell them their program has, needs improvement in particular areas, and all of a sudden they start to examine what is it that you've done? Is it appropriate? Were those appropriate measures that you used? Was the sample sufficient? So I think that, that's in response to being surprised by negative findings. If we can work with people and keep them informed along the way, I think we really lessen the likelihood that something like that could happen. So this is our sixth step, which we've actually been talking about throughout this webinar. And the sixth step is to ensuring use and sharing lessons learned, building capacity to use results. That's sort of my piece that I built in there. And so what does it mean? Well, I think we need to determine the current capacity of your stakeholder audience or your users to actually use the results. And that we have to prepare important groups for use. That's actually a strategy there. And I think one way to do that is through developing a communication and reporting plan. So people get a sense of what is it that you're going to offer them and what it is that they might learn throughout the course of the evaluation. Next slide, please. So here are the points that are described in the model itself. The first is that we shouldn't assume that the lessons learned throughout the course of the evaluation will automatically translate into informed decision-making and appropriate action. And I say, there's always political factors that can interfere with this. And so we need really sort of to be very deliberate about helping people use the information, helping them disseminate it appropriately, and preparing for use involves sort of thinking strategically and really sort of being persistent, which, as we've talked about, really begins sort of in the earlier stages of this evaluation process. Next slide. Here are the how it's described in the model itself. So is the evaluation organized from the start to achieve intended use by intended users? Have we gone through the steps of rehearsal, which I would consider to be those mock data scenarios? What kind of communication has occurred along the way? Do your stakeholders trust you? And then how will you follow up with them? What is it that you will do to help them use their findings? Now, some evaluators really think that's not their responsibility. But just to put that out there, there are definitely some people who say, you know what, I turn over that report and whatever happens with it, happens with it. I think that if you've worked on ensuring use throughout the process, it's going to happen. But I've definitely been involved in evaluations where I've really worked to promote use, and at the end of the day, the report doesn't go as far as I would like to see it go. And so this idea of the conceptual use, of process use, of building capacity, it's important for us to also recognize that those are also indications of use. Next slide, please. So here are the critical activities, very concrete steps that we can take. Ones that we haven't talked about would be scheduling follow-up meetings to help facilitate the transfer of evaluation conclusions into appropriate actions, and disseminate both the procedures used and the lessons learned, using tailored communication strategies that meet the particular needs of that audience. And that, I think, is very important. And we get to that with this evaluation communication plan. Next slide, please. Okay, so why an evaluation communication plan? It's not something that I've always done. I haven't always said, hey, a communication dissemination plan should be part of my overall evaluation plan. But these days, it's absolutely something that I include in all the proposals that I submit. And when I am negotiating with stakeholders, trying to figure out exactly what it is that we're going to do, this communication plan really helps them, because oftentimes thinking about the methods and the kinds of data we're going to collect and when we're going to collect it and from whom, they get lost in the detail. When you present them with a plan that says, here's what I'm going to give you, and here's what you might expect to learn from what I'm going to give you, they sort of perk up and they become a little bit more interested in what it is you're talking about, and it kind of jumps off the paper in a way that, like a data collection plan, at least in my experience, doesn't have that same sort of impact. I also think that it helps inform the budget, because oftentimes your lead evaluator and the more senior people on your staff are the ones who are responsible for preparing key dissemination products. And your time is probably going to cost more than other people's time on the grant or on the project. And so it will give you a sense of, if I'm going to have to pull together over the course of a 3-year evaluation 6 key reports, it's likely that I'm going to have to write them, and that's going to be, I have to consider that as part of my time, and I'm the most expensive person on the project. So it does help me sort of sketch out my budget. Next slide, please. So a communication plan could be as simple as what I'm describing here. It could be more complicated. But just to give you a sense of sort of a basic communication plan, you want to identify the intended audience, the format or the style of the communication, frequency and timing, and then any deadlines. Next slide. So here's what it might look like, and this would be sort of one cell of a communication plan. So the stakeholder audience would only be for one audience. So let's say it's from my funder. And what would be my communication need or the reporting need? So I need to do a progress report on the evaluation activities. I need to give them some interim findings, some final findings, any other reporting activities. I need to go speak to a congressional subcommittee, whatever it might be. And then I describe the format and then when it's needed. And if you note, there's the citation there. There's an actual book published by Torres and Preskel, and they offer some really good examples of some of these communication plans. Next slide. So things we need to think about when we are deciding upon what the format is going to be. And some of this is obvious, but things for us to think about: accessibility. I think now we often use the web, but often there are definitely stakeholder audiences and user groups that don't have access the way we do. Reading ability, familiarity with English, familiarity with the program or the evaluation, also familiarity with research and evaluation methods. What I find is oftentimes other evaluators and researchers love to see the methods section, but other program people, particularly politicians, they don't want to see it. So I give it a really short summary in the body of my document, and I put it at the end as an appendix. So it's there, but it's not bogging them down. And then also, how familiar are people with actually, using evaluation findings? Are they accustomed to getting evaluation reports, so on and so forth? Next slide. They can be either formal or informal. And informal communication formats are, short communications, personal discussions, working sessions. One thing to be mindful of is, we are a program evaluator. When we are with program people, they listen to what we say. And so even in informal conversations, we should almost be thinking about that as we're giving them information. Some sort of reporting is happening here. So we need to just be mindful of that. Next slide. Formal communication formats, verbal presentations, videotapes, conferences, public meetings, written reports, executive summaries, chart essays, web poster sessions. I find, at least in my world, the executive summary is probably the most critical in terms of formal communication. If I could keep it down to 3 pages, then all the better. I always say that I think when people look at a product from an evaluation, they do a cost-benefit analysis. What's the cost in time to the benefit and what they will learn? And so if we can get what it is that we want them to know in there and nothing else, that's great. Also in an executive summary, I always include a page number next to a point that I might be making. I try to keep it in bullet point format so that if the person wants to know a little bit more about this particular point that I've made in the executive summary, they know exactly where to go in the report. that there isn't any flipping around. I think if they have to flip around for more than 25 seconds, they're going to stop looking. So that sort of thing. A chart essay is something that they use in public policy often. You can probably Google it. It is it's a one-page summary, and it starts with the evaluation question at the top, about 3 or 4 sentences about the methods, and the rest of it is about the next third is the results, and then the next third are your what you've learned. Maybe recommendations, maybe discussion points. So it's a very straightforward, and you would do one for each evaluation question. Next slide. So something to think about, and we can use sort of the adult education literature here to help us when we look at this particular slide, is that most adults learn with some combination of an interactive and a less interactive product. And so what I often find is some presentation of the findings coupled with an executive summary or a report, but hopefully something short that they will read, is really the best way to get people to use information. Some of our least interactive ways of communicating, I find that, they have less of an impact. So engaging people, getting them to talk and to sort of co-construct their learning with others is very useful. I find to be a very useful strategy. Next slide. So what do we know? Basically, in sum, now that we've gone through these steps, there are factors that are necessary for obtaining use. Buy-in and credible evidence, as well as political factors. Evaluation operates in a political context, and it will absolutely have an impact on steps 4, 5, and 6 of the model. Potential decision makers do not operate with a clean slate and absolutely have a working knowledge about policies and programs. So we should be aware of what they think about their programs and policies and the impact of them. And as I mentioned earlier, that a decision is not the only evidence of evaluation impact, that we have process use, that we have capacity building, and we also have conceptual use. So with that, I say thank you for your time and attention, and I will open it up to any final questions.